Hello, welcome to VMC. I'm Dr. M. Today we are going to be covering the symptoms and behavioral changes that you might see in cats and dogs that are having gastrointestinal issues. Join me, you'll learn something. So first, let's talk about nausea without vomiting, because it's very common for our pets to have nausea but to not actually be vomiting. Pets with nausea will do things like licking their lips a lot. They might walk up to a food or water bowl, stand there, maybe even sit there. They look like they want to eat, but they never actually do eat or drink, and then they walk away. They might be drooling a lot. They might be eating things that aren't food items. Some animals that are experiencing nausea will be eating grass, they might be eating dirt, they might be eating anything around them that is not food items. Plastic, toys, carpet, you name it. I'm sure that some animal has eaten it. We call this particular phenomenon pica, and that just means when an animal is eating things that are not food items. And it's important to recognize that this can be a symptom of nausea. It can also happen that animals will have behavior changes when they're having GI upset. You might notice that they get a little bit grabby when you're giving them treats. You might notice that they are trying to eat things they don't usually. Sometimes eating grass can be a part of this. Some animals eat grass just because they enjoy it, and that's also okay. But if this is something that your pet didn't do before, or they've started doing a lot more of it than is normal, that is a reason to note if this persists. I should bring them in to see my veterinarian. The next thing that we need to discuss is the difference between regurgitation and vomiting. A lot of people don't even know that there are two different phenomena. When a pet is regurgitating, that means that they will all of a sudden, with no warning, just have food shoot out of their mouth. Their abdomen is not involved with this. It's not contracting, it's not heaving. And this is contrasted with vomiting, which is when food items are actually coming from the stomach up through the esophagus and out the mouth. So with vomiting, you will see the abdomen contract. Often they will have a lot of warning that vomiting is going to happen. So you might get some pacing or whining or vocalizing in some sort of a way, a lot of drooling, and then, the vomit comes out. And the reason it's important to know which is going on is because regurgitation actually happens when the food isn't even really making it all the way into the stomach. It's getting stuck in the esophagus. And this can happen because of an enlarged esophagus. It can also happen with certain heart issues. It's important to differentiate between the two, as the diagnostics that are necessary will change dramatically if your animal is regurgitating versus if it is vomiting. GI upset can also be noted with animals if they are having more flatulence than normal. So they would be passing gas more frequently. For all animals, it is normal and common and expected to have some flatulence occur, but when this starts to be room clearing, or you just notice the frequency has gone up a lot, this is a sign of GI upset. And with this end of things, pun intended, you could also notice that instead of having nicely formed stool, that you have softer stool that isn't well formed, or you could even have liquid stool. And this sort of diarrhea is also a sign of GI upset. But constipation is also an issue. And so if you have a pet that is posturing to defecate, but they are not able to produce any stool, this is urgent and you need to see a veterinarian right away. For cats, I would even classify this as an emergency, because often cats that are doing this, they actually have a urine blockage, and this can quickly become life-threatening. For dogs, that's less common, but Either way, if you notice your pet is posturing to eliminate and nothing is coming out, you need to get to a vet clinic. I will add in the description box a chart that helps you to assess what healthy stool looks like, and so you can use that chart to assess whether your pet's stool are appropriate or whether they're getting too soft or too hard. The other thing that you might see from the back end as a symptom is that animals with GI upset could have issues with their anal glands. And those anal glands are kind of at the 4 o'clock and 7 o'clock position if you imagine the rectum as a clock. And when those anal glands are functioning correctly, every time the animal has a bowel movement, the firmness of the stool will compress the anal gland, and there will be a thin layer of anal gland secretion over every bit of feces that the animal defecates. And when the stool doesn't contain appropriate amounts of insoluble and soluble fiber, then the consistency of the stool will not be ideal for expressing those anal glands with every bowel movement. And when those anal glands don't get expressed, then that means that the contents of them gets larger and larger, and eventually that anal gland can get infected, or it can even rupture, which is excruciatingly painful, and then you can have, you know, longer term issues back there if you start getting some scarring around the anal glands, etc., etc. The other thing with anal gland issues, there is a small percentage of dogs that actually have a food allergy. And the only symptom that you'll notice as a caregiver to that animal is that they have recurring anal gland issues. And so if you are feeding a WSAVA compliant food, and perhaps your veterinarian has even had you trial a prescription high fiber formula and your pet is still having anal gland issues, at that point a prescription hypoallergenic food trial would be the next step to rule out if your pet actually has a food allergy going on. Sometimes you will hear borborygmus, which is the fancy word for rumbly stomachs. So if you're noticing that, do pay attention to it. If you are noticing that your pet is having audible abdominal noises more frequently, or that borborygmus is being paired with nausea or diarrhea, then you know that your pet is having some GI distress. It is also a sign of GI upset when you have a pet that used to really enjoy their food and doesn't any longer. I will hear from people, oh, they're a picky eater, but in reality that pet actually has underlying GI disease that hasn't been diagnosed. So it is important to, first step is to feed a formula that is WSAVA compliant, and I will link what those standards are in the description box below. And if you are already doing that, you can consider an over-the-counter sensitive stomach sort of a formula that is from a WSAVA compliant company. And if that is not successful, then you do need to start working with your veterinarian. If you have a pet that you notice tends to vomit early in the morning or first thing in the morning, this could be because their stomach is being left empty for too long. So some pets will do okay with having 2 meals per day, say, but I like to give at least 3 meals per day to my pets, just like I tend to eat around 3 meals per day. I find if my stomach is left empty for too long, I get some nausea, and it seems that some of our pets are the same way. And so if you have an animal that tends to vomit in the morning, then it's very important that you add a last meal before bedtime so that their stomach can be more regularly full, and that in many cases will stop them from vomiting in the morning. If it doesn't, however, then make sure to follow up with your veterinarian, as some pets need prescription medications to help, and some end up having stomach outflow issues, or they have an irritable bowel type issue going on, or stomach ulcers, etc., and they just need a different treatment plan. I am going to add in here a specific note about our cats, as it has become a bit of an accepted phenomenon that, oh, cats have hairballs. And actually this isn't true. What we know from the research that's been done is that our cats, when they have a healthy GI tract, the amount of fur that they ingest while they groom should pass right through them and should not cause any vomiting. Now, it is considered acceptable that if a cat vomits once per month, whether there's hair in it or not, that is considered within the realm of normal for most cats. However, if they are bringing up hair more than once a month, or if they are vomiting food or even just bile acids or just stomach liquid any more than once a month, this is something that you need to see your veterinarian for. If your pet has abdominal pain, they might hunch their back, or they might also do what we call the prayer posture. It almost looks like a downward dog yoga position. That's incredibly common for animals that are having GI distress or pancreatitis and other abdominal sorts of pain. You could also notice bloating, and if you see that, especially with a dog who is bloated and looks like they're trying to vomit but nothing is coming out, this is an emergency because they could have a stomach bloat issue, or that bloat could have twisted and that torsion then becomes a GDV, a gastric dilatation volvulus, and this is a problem that quickly is life-threatening. It's most common in deep-chested and narrow-waisted dogs, but it can be seen in cats and it can be seen in any dog breed. So if you ever see those symptoms, make sure you get to a veterinarian right away. If your pet continues to vomit or loses interest in their meals, or their diarrhea or soft stool is not resolving, or they're acting off, they're acting tired, they're acting disinterested, they're just not their regular selves, those are all reasons to see your veterinarian. And depending on what your veterinarian finds on their physical exam, you could expect a blood work panel, a fecal test. Sometimes fecal samples need to be sent out to labs to test for things like Salmonella and E. coli and Giardia, etc. Sometimes a prescription GI-friendly diet is necessary. Sometimes we do abdominal ultrasounds. Sometimes we take a scope and go down the esophagus and look at the inside of the stomach and the esophagus, and that's called endoscopy. There are hundreds of different causes for GI upset. So if your pet is having symptoms, you may need to see your veterinarian a few times, or you may even need to be referred to an internal medicine specialist to do some tests that your local GP isn't able to do. And this is common because there are so many different things that can be going on. But don't give up and don't accept that this is just how they are. It's important to keep investigating until a way to resolve their symptoms is discovered. Please subscribe to the channel if you aren't subscribed already. If you've learned something today, please like the video. It really does help us out. And if you have something that you want me to create a video on, please comment it down below. I'm always looking for video ideas to add to the list, and I want to create content that you find helpful. And we'll see you on the next video. Bye!